Hey, check this out. Wally Gardner back again with Docs. So I want to talk to you a minute about seating. We've talked about in the past seating the patient and the difference that can make. I want to talk for just a minute about seating yourself as the operator. And when I say the operator, I mean the hygienist or the doctor. And a lot of times, and I know because I've got a wife who's been a hygienist for 36 years now, right? And I've had to teach her how to sit properly. And that helps by teaching yourself how to sit properly in this chair, and then teaching you how to use this chair, and specifically this double articulating headrest to manipulate the oral cavity can save you tons of anguish and pain as you mature through your career. So let's start with this chair. So a lot of times I hear, man, I feel like I'm barely sitting on the chair. Well, a good dental stool, and these are stools and this is a patient chair, but a good dental stool is going to have three functions to it, right? It's going to have the ability to go up and down, and then you're going to have the ability for the bottom seat to tilt with you once you get into position. And you're also going to have the back, or this lumbar support, that can move up with you to give you support as you're in position with the patient. Now, how do we make these three things work together? And so what we want to do is start with this base. And I'm seated. I want to be able to sit on this chair with my entire bottom on the bottom of the chair, covering the entire surface of the chair. I also want my thighs to be just a little bit above parallel to the floor, right? That way I'm taking that pressure off that femoral artery down here. Now, once I'm seated that way, I have a patient in the chair. I want to make sure that I adjust this chair so that my arms can hang naturally while I'm working, right? So up here would not work, right? Because I'm gonna have to do this. That's way too much pressure up here for me to do day in and day out, right? So I'm gonna, as I lean this chair back, I'm going to get my arms in just the right position. And then as I get in here, and that depends, you may work at a 10 o'clock, you may work at a true 12 o'clock position, but once I do that, I'm gonna reach down here and I'm going to adjust this tilt mechanism, which is going to allow me to tilt into place. And it's also going to allow that lumbar support to come in to give me that support in my back so that I can have my feet firmly on the ground, my rear end is well supported, and then my arms can hang naturally while I'm working on the patient. Now, here's the key though. When I get up and leave, rather than just get up and leave and then come back and sit down, if I've not released this lumbar support and the tilt back, when I come back, I'm going to sit a little bit further up on the chair, and I'm going to get myself back in place, and I'm going to adjust that lumbar because it's not there. And then if I stand up and leave again and come back and I sit down, I'm barely on the chair, and that's only getting up twice. So the third time I sit in this chair, I'm no longer here. So what's really important is when you get up from this chair, be sure to release that lumbar support all the way back so that when I come back, I can sit all the way back on the chair again. Remember in that other video, we told the patient to scooch all the way back. I want you to scooch all the way back on this stool. That way you're supported well.